Good afternoon, my name is Joe Hulin. I'm a researcher at SHA at the University of Sheffield, and today I'll be presenting a project looking at the predictors of staff turnover in NHS mental health trusts. Issues with workforce retention in the NHS are widely recognised, and they've worsened every year since 2011. In 2020, 1 in 10 posts were unfilled, and there were around 91,000 vacancies reported in 2021. On average, retention rates in mental health services are lower than the remainder of the NHS. For example, 13.4% of mental health staff left in 2018-2019 compared to 11.9% across all employers. These unfilled posts have major implications for patient care, with the use of agency staff and high caseloads meaning patients are seen less often, they have shorter appointments, and there's less continuity of care. Educating and recruiting staff also involves significant costs for the NHS. And for these reasons, we need to further understand what affects the retention of staff in NHS mental health settings, and the research I'll be presenting today forms part of a larger study which aims to do that. So the Retention of Mental Health Staff Project, or ROMS for short, consists of 3 key work packages. The first of these work packages was a realist review, and the aim of this work package was to review existing retention research in all healthcare settings to identify what works for whom in what circumstances. If you'd like to hear more about this particular work package, my colleague Emily Wood will be presenting findings from this at this year's conference. The second work package, which I'll be presenting today, involves an analysis of routine data sets to investigate relationships between staff retention, staff experience at work, and patient outcomes in different trusts. And the findings from this study also inform the next stage of the work by helping identify potential case study sites where we could learn from good practice and identify policy recommendations. I'll speak a bit more about this later in the presentation, and the key findings from this work are also being presented by our colleagues Sally Olsen and Jackie Long at this year's conference in 2 separate presentations. Following on from this, we'll aim to triangulate the findings from these 3 previous work streams into a coherent set of findings and recommendations. So as mentioned, I'll be presenting work from work package 2 of the ROMS study, which seek to investigate relationships between staff retention, staff experience at work, and patient outcomes through the analysis of merged NHS datasets. This involved data from 57 mental health trusts, and data was provided from NHS Digital covering the years 2015 to 2019. And I'll just spend a brief moment going over the types of data we collected as part of this analysis. So the key outcome we were looking at was staff turnover, and this was measured using the NHS Stability Index, which, to put briefly, is a percentage of staff at the beginning of a period which didn't leave their role. We also collected data on staff experience, which was obtained from the NHS Staff Survey. From this survey, we used the overall engagement score, and we also created a component score which looked at staff satisfaction. And to create this, we used a principal components analysis of 6 key findings which were undertaken on staff survey results from 2018. In addition to staff experience, we also measured patient satisfaction, and this measure was derived from the Community Mental Health Service User Survey. And for this, we used a response to a question in the survey which asked respondents to rate their overall experience of NHS mental health services on a scale of 1 being a very poor experience to a scale of 10 being a very good experience. We also included data on staff sickness rates and several background factors such as CQC ratings, the type of trust, for example, whether a trust was considered a mental health and learning disability trust or a combined mental health, learning disability and community trust. We also looked at the region in which a trust was based and also whether the trust was in a rural or more urban environment. So in terms of the analysis, the first stage of the study involved identifying potential case study sites for work package 3 of the study where we could learn from good practice. And to do this, we looked at data over the previous 2 years to identify trusts with high and low levels of staff turnover and also trusts with high and low levels of staff satisfaction. And we did this through visually inspecting scatter plots of these 2 variables. So as you can see here, we identified 6 case study sites in total. Some of these had high satisfaction, low turnover, and some had low satisfaction and high turnover. And you can hear more about the findings from these case study sites in presentations at this year's conference by our colleagues Sally Olsen and Jackie Long. And following this, we then undertook a series of regression analyses to try and identify whether staff turnover could be predicted by staff satisfaction, staff engagement, patient satisfaction, and staff absence. And we did this controlling for trust type, the region in which the trust was based, the location of a trust, i.e. whether it was in a more urban or rural environment, and also CQC ratings. We also repeated this analysis controlling for prior turnover. And finally, we undertook some growth curve analyses to try and examine whether changes in turnover over time were predicted by these factors. So in terms of results, we found that only staff absence and region were significant predictors of staff turnover, with a 1% rise in staff absence associated with 1% higher turnover, and trust located in London having 2.3% higher turnover than other regions. Unfortunately, the growth curve models failed to converge, and therefore no results were obtained for this stage of the study. So to conclude, we were unable to establish many links between the staff and patient experience and turnover, and this is likely due to a small sample of organisations in the study, which led to low statistical power. It is therefore recommended that future research collects data from smaller units to allow for a larger sample size. We also recommend that future work tries to consider indicators of patient outcomes, such as did not attend rates, and also the impact of a labour market variation on staff retention, two factors that we were unable to collect data on for this study. Despite limited evidence, the study still played a key role in the larger project in helping identify case study sites where we could identify good practice, and once again you can hear more about these findings in presentations by our colleagues Sally Olsen and Jackie Long at this conference. So thank you for taking the time to listen to today's presentation, and also thank you to Emily Wood and the remainder of the ROM study team who made this study possible. If you do have any further questions, please feel free to contact the ROMS team using the email address on this slide. You can also visit the websites listed to find out some further information on the study. Thank you very much for your time.